Hi everyone, welcome back. Before we dive in, a quick disclosure. What you're seeing is an AI video likeness of me, Dr. Karen Francois. As a physician working full-time night shifts and a dedicated mom of 3, one of whom has special needs, my schedule is demanding. My journey wasn't traditional either. I spent 3 years as a teacher before pivoting to medical school, so I deeply understand the struggle, the self-doubt, and the sacrifices it takes to change careers and chase a vision. To make sure I can show up for you consistently without taking too much time away from my work and kids, I use this technology to create my videos. I am fully dedicated and committed to helping those like myself continue their dream in medicine. Thank you so much for understanding and supporting this channel. Now, let's get right to the top 5 high-impact careers in medicine outside of being a doctor. Number 1. Advanced practice providers, specifically physician assistants and nurse practitioners. PAs and NPs examine patients, diagnose conditions, prescribe medications, and perform procedures, delivering top-tier patient care. On average, they earn between $130,000 and $140,000 annually, with surgical subspecialties reaching even higher. To get here, you'll complete a 2 to 3 year master's degree following undergrad prerequisites. Admission is highly competitive, often requiring over 1,000 hours of direct patient care experience just to apply, making it rigorous but significantly faster than the medical residency route. Number 2, healthcare administration and health services management. If you want to lead health systems, direct hospital operations, or shape policy without treating patients directly, this non-clinical executive route is key. Average salaries range from $118,000 to over $150,000, with senior hospital leaders earning well above $200,000. Most positions require a Master of Healthcare Administration or an MBA. The academic path is moderately accessible compared to clinical routes, but climbing to senior executive roles requires sharp business acumen and strong strategic leadership. Number 3, Cardiovascular Perfusionist. These highly specialized surgical team members operate the heart-lung machine during open-heart surgery, maintaining blood flow and oxygenation while the patient's heart is stopped. Perfusionists average $140,000 to $180,000 per year, with call pay and experience often pushing compensation over $200,000. Entry requires a 1 to 2 year specialized master's or post-baccalaureate certificate. Admission is extremely selective because there are fewer than 20 accredited programs nationwide, but it offers immense surgical impact. Number 4, clinical pharmacist and pharmacologist. Working directly in hospital oncology units and emergency rooms, clinical pharmacists evaluate complex drug interactions, manage dosage protocols, and advise care teams on precision medication therapy. Average salaries range from $137,000 to $145,000 annually. Getting here requires a 4-year Doctor of Pharmacy degree plus 1 to 2 years of competitive hospital residency training for clinical specialization. It's an intense, science-heavy pathway that places you at the center of modern treatment safety. Number 5, genetic counselor. Merging cutting-edge genomic science with compassionate counseling, genetic counselors evaluate DNA data for hereditary risks like cancer, prenatal conditions, and rare diseases, guiding families through crucial choices. They earn an average of $98,000 to $108,000 annually, with biotech and outpatient diagnostic roles exceeding $120,000. Entry requires a 2-year master's in genetic counseling. Acceptance rates are notoriously selective, often around 10 to 15% nationwide due to limited clinical training slots, making it competitive yet deeply rewarding. Medicine is a vast, incredible field, and becoming a physician isn't the only way to build a deeply fulfilling, high-impact healthcare career. If you take a look at the comparison chart on screen, you'll see the real breakdown. While traditional medical school often exceeds $250,000 in tuition alone, followed by years of low-paying residency, these alternative programs average between $40,000 and $100,000 in total tuition. The financial and personal reward is huge, In just 1 to 3 years of focused study, you can step directly into high-paying, six-figure leadership and clinical roles without accumulating overwhelming debt or putting your family life on hold. As someone who pivoted into medicine later in life, I promise you that your dream of making a difference in healthcare is completely within reach. Which of these careers caught your attention? Drop a comment below, like, and subscribe for more real talk medical career insights.